Hi everyone. So today is going to be the next lecture. Okay, continuation of the assessment. Yeah. Okay, so now we're going to look at what are the options that is available to help low vision patients who are having a problem related to their distance vision. Okay, so these are the examples of devices that is available for distance vision problem. Okay, when patient have problem related to distance blur vision, so these are the options, and all of these options, have the same name. It is telescope. Okay, so if you look at these pictures, right? Okay, these are all telescopes. So for managing a patient who's having a distance vision problem, right? The only options that we have is telescope. Okay, so this is monocular telescope. Okay, this is also a monocular telescope. Okay, this is a bioptics. Okay, these are the clip-ons. Okay, this one is like spectacles. Okay, mounted on spectacles, you just wear it on. Okay, and this one is the telemicroscope that comes together with the telescope. Okay, so basically the only options that we have, if let's say, that means when patient comes in, right? Okay, they come with a complaint of, having distance blur vision, okay, or anything related to distance blur vision, right? And then what we will do is we will, after, we have like a history taking session with them. The next thing that we will do is we will do assessment, obviously. Okay, so the first assessment that we usually do is visual acuity taking. So by doing visual acuity taking, we will have idea of, whether this patient, what is the visual acuity of the patient. Okay, and also if let's say there is any improvement with the pinhole measurement or not. So based on that, we will make a decision whether we want to continue with the second assessment, which will be the refraction. Okay, so if let's say there is a drop in VA, obviously they will have drop in VA. So and also if let's say there is improvement in pinhole measurement, then we'll continue with a refraction. So once we do the refraction, if let's say the patient vision can be improved, obviously even after the correction also, they should be 618. Then only they fall into the category of low vision. Okay, so based on that, if let's say they can achieve the best VA that they could, okay, so obviously usually with that vision, they will not be able to still do the activity that they want to do. Like for example, if let's say they want to look at, blackboard in the school or whiteboard in the school, or if let's say they want to look at bus numbers while they're traveling, or the display board of anything, it can be, for in the train station, bus station, or if let's say they go to mall. Okay, so anything related to that, or watching television. Okay, if let's say there is a problem with that, okay, after we give the correction of the spectacles, okay, the next step that we do for this patient is by trying to give them with telescope, okay, and see whether that can improve the vision of that patient or not. Okay, so the option that we have after the spectacle correction will be telescope. But one thing that we have to remember related to this telescope is, number one, telescope, it doesn't work like a spectacles. Okay, with spectacles, we have, obviously we have like a both eye vision. Okay, number two is, when you wear the spectacles after like, 2 to 3 minutes, you don't feel like you're wearing something. Okay, because the vision that we see through the telescope, it is actually similar to our naked eye. Okay, so there is no difference between that. But when a person is wearing telescope, right, it's totally different. When a person is wearing telescope, right, first the field of view will be smaller. Field of view will be smaller. That means, what is field of view is, if let's say now you're looking straight, okay, you will be able to see the whole screen. Okay, and also some information from the sides. Okay, if let's say there is a bottle on your table, if let's say there is a bag on your table, if let's say there is a fan in the ceiling, you still know the presence of the side vision, although you're not looking directly to that object. Okay, so but then when you are using a telescope, right, maybe there's only one small portion that you will be able to see. Okay, whereas the side visions, right, it will be like totally blackout. So that's why we say that when a person is wearing telescope, the field of view is restricted. They won't be able to see the whole picture of the world. So this is not comfortable, for a person who's using it, because they're used to the whole world, and suddenly now their world gets smaller with the telescope. So that might not give a comfortable vision as spectacles. Okay. So number three, how this telescope function is, okay, when we use this telescope to look at something, it actually brings the image of the object closer and the image is in a bigger size. So that's how this telescope functions. Okay. When comparing to spectacles, definitely there are a lot of drawbacks with telescope, but what we have to remember is, for someone who can't see things, right, for them, if let's say they're able to see the image of an object, even though it's in a smaller field of view, even though it's bigger, okay, it appears closer, but that makes them to get some information about what they're looking at, so they would appreciate this. But for a normal person like us, we won't appreciate this because we have like a good vision, we have binocularity, we have like a big field of view. So when we use this telescope, it might not look beneficial, but for someone whose actually vision is very poor, very limited, they would appreciate the image that they see through the telescope. Okay. So whatever that we are trying to give to the patient, we should look from the perspective of the patient, whether they will appreciate it or not, or whether they will actually, benefit from this or not. Okay. So for the topic for this video is going to be on low vision aid for distance. So this is for the subject of OPT 3475, low vision and further optometric care. Okay, so this is the next lecture on the distance aid. So first of all, there are two types of telescope as already mentioned, earlier. So one is astronomical or Keplerian, and another one is Galilean. So there are two types of, telescope that is available. So when you look at the telescope, right, if let's say I put like 5 telescope on the table, clinically, you don't need to know which one is Galilean, which one is Keplerian. But as an optometrist, you have to know that there are two types and how they are made of. Okay. So because then only you will understand how the telescope functions. Okay. But for a clinician, when you want to prescribe to the patient, this Keplerian and Galilean doesn't make any difference. Okay. As long as that magnification, helps the patient, then it's okay. You carry on with that prescribing it. But as an optometrist, you have to know the optics behind it. Okay, both these telescopes are afocal design. Okay, the purpose, as I mentioned earlier, to view objects at infinity, far away. And the closer the telescope is to the eye, the bigger the field of view. So how to get the maximum field of view is by putting the telescope closer to the eye. If let's say you put it further away from the eye, okay, the field of view gets smaller. Okay, spectacle wearers should use telescopes as close to the eye as possible because there's already a vertex distance, right? So using it closer to the spectacles will be giving them a bigger field of view. Okay, therefore they should either take their spectacles off or fold the rubber eyepiece backwards to allow maximum field of view. Okay, so there are two ways. If let's say the spectacles is not actually improving the vision of a person, they can just remove the glasses. Okay, if let's say someone who's having like vision of like 660 without glasses, with glasses is like 618, there's a 4 lines improvement. For those kind of patient, they have to use with glasses. Okay, so that the clarity of the image that they see through the telescope would be good. So for them, they have to actually put it, very close to the glasses so that they get the maximum field of view. So what are the advantages and disadvantages of the telescope is, number one, the advantage is, okay, it is the only device that we have for distance viewing. Okay, so there are no other tools other than spectacles, obviously. So when it comes to low vision device, okay, this is the only tool that is available for distance viewing. Okay, number two, it can be prescribed binocularly or monocularly depending on the need of the patient. So usually we'll prescribe patients with a binocular telescope when patient wants to look at, wants to watch television, okay, because it's comfortable to use both eye. And then if let's say they want to, in certain countries like US and UK, there is a limited place where low vision patients with certain visual acuity and with the help of biotic telescope, they're still allowed to drive. So for that kind of patients, we prescribe them binocularly, but the rest of it is usually monocular. Okay. And then increase working distance, because as I mentioned, the image appears shorter for the patient. Okay, so they can actually view things from a very far distance. No need to move closer to actually get the image clear. Okay, and the focus can be varied. Okay, just need to twist the telescope, and then the image, clarity would be focused on defocus depending on the need of the patient. And also it can be hands-free, like spectacle mounted, okay, like a normal spectacle at the top of it. Okay, we can have like a mounted telescope, or it can be like a clip-on also. So it can be hands-free, not all the time that patient has to hold them all the time. Okay. And the disadvantages is, one, it is expensive. If let's say we get uh the the telescope from Germany, like Aschenberg brand. Okay, it is super expensive. The cost price itself can be like thousands, 2,000, 3,000. Okay. And we also can get a cheaper version also for few hundreds. Okay. But usually, if let's say you go for the original one, it is expensive, and cosmetically it doesn't look good. Okay, when a patient is using that, right? So obviously they will be identified to have a vision impairment. So not many people will be very happy with this. Okay, just give me 1 second, let me check if let's say it's still recording. Okay, it's recording. I shall continue. Okay. Okay. And the third disadvantage, it is slightly heavy. Okay, if let's say the magnification higher, right, it will be slightly bulkier. Okay, and then it will have, it will be slightly heavy, especially if it is spectacle mounted, it will be heavy. If it is a monocular telescope, it won't be so heavy because you just need to use it whenever you want and then can remove it. Okay, and training is required. It's not like spectacles where you can, get the prescription, get the glasses done, you wear it, and then you just wait for a few days, then you'll get adapted to it, right? It is not like that. Telescope need training, how to use, how to scan, how to track, how to trace. Okay, need to be taught to the patient. And obviously, as I mentioned earlier, there will be poor field of view. The field of view will be limited. It won't be as similar to the glasses with a, good visual field of view. Yeah. So that will be the advantage and disadvantage of telescope. Okay, now we move on to the types of telescope. There are two, as I mentioned. One is Keplerian, another one is Galilean. So this Keplerian is made up of, okay, all the telescope is made up of two lenses. One is eyepiece, another one is objective. Okay, for Keplerian, both the eyepiece and objective lenses are convex lenses. So this, you can see here, these are the convex lenses, and the image that is produced is actually inverted image. Okay, a prism erecting system incorporated into the system to re-erect the image. So the original image that is produced by the Keplerian telescope will be inverted. Okay. And then there is a prism that is placed in the Keplerian telescope to re-erect the image so that it looks exactly as what we see with the naked eye. And the length of the telescope will be the sum of the focal length of the eyepiece and objective. That is the reason why Keplerian telescope are usually longer. Okay, so this incorporation of the prism erecting system adds to the weight and bulk. That's why usually Keplerian telescope, they are big, bulky, and slightly heavier compared to the Galilean. They come in a very tiny telescopes. Okay, the advantage of this Keplerian telescope is they have better field of view and the image quality is superior compared to the Galilean telescope. So Galilean telescope is made of two lenses also. One is eyepiece, another one is objective. The eyepiece is the negative lens, while the objective lenses is, is a positive lens. So it produces an erect image. So there is no need of having prism, okay, to re-erect the image. limited to 3 times of for distance viewing. So the maximum magnification that we can have with Galilean telescope are 3 times. Okay. So if let's say patient needs a higher magnification, then you have to get it from the Keplerian type. Okay. So, and also how to differentiate between this Galilean and Keplerian telescope is Keplerian is usually whatever there is magnification that is 3 times and more, they are all Keplerian telescope. Okay, whatever that is lesser, okay, can be Galilean or can be Keplerian. So lack of prism system will also make them more lightweight. It will be lighter and also smaller and more compact because, they don't have like a, prism inside, and they don't have like a longer focal length. So the difference between Keplerian and Galilean in some would be the eyepiece. Okay, Galilean, they have a concave eyepiece, while the Keplerian is convex. The size of Galilean is smaller and shorter, while Keplerian is longer and heavier because they have prism. Magnification is maximum is 3 times only, Galilean. Okay, while Keplerian is maximum up to 15 times because they have the prism in it, and also they come with both convex lenses. And for Galilean, no prism is integrated, while for Keplerian, prism is integrated. And if you check the markings in the the markings in the telescope, right? It is very important to know what are the numbers stands for. Okay, like for example, usually we will see 3 readings or 3 numbers. Okay, like for example, like 8, and then there'll be x 20, x 7.5. Okay, so what this stands for? Okay, the first number here, number 8, stands for the magnification. How much it makes the image bigger than the original one. Okay, so that is magnification. And this magnification is more like a prescription. As how we give a spectacle Rx, right? We'll give a spherical power, we'll give astigmatism power, and then we'll give a axis. Okay, similarly, for this telescope, right? So there is only one reading that is important. That the other two is just a supplementary for our understanding, which is not involved in the prescription. Okay, that means we don't select based on the later 2 numbers. Okay, we select based on the first number only, which is the magnification. So the second number, stands for diameter of the objective lens. Okay, diameter of the objective lens, okay, in millimeter is recorded as the second reading. And the third reading is the field of view. Okay, the space that patient able to see through this telescope. Okay, it's written that. Okay, so when we want to prescribe someone with telescope, right? Okay, when we already calculate the magnification that is actually required by the patient and all that. Okay, so we try to match with the first number. The second two is just supplementary for our understanding. It is not involved in the prescription. We don't select them based on the diameter of the objective lens or the field of view. Okay. Okay, so what is field of view? As I mentioned earlier, okay, increases with the diameter of the objective lens. The bigger the diameter of the objective lens, okay, so the bigger the field of view would be, or the higher the magnification, okay, it goes contrast with that, the smaller field of view. Okay, as I mentioned earlier, if let's say with spectacles or naked eye, we can see the whole picture, but with the telescope, we will be only able to see the one portion of it. So this is field of view. So it's limited. Okay, you won't be able to see this outsides or at the peripheral. So how do we calculate magnification? Okay, so it is based on this formula. So magnification stands for this M equals to expected VA divided by habitual VA. So what is expected VA is when you want to do certain activities, right? There is a required VA that we should have for us to be able to do that activity. For example, if let's say a patient is watching, wants to watch a television. Okay, it can be anyone. Okay, even if let's say you're a spectacle wearer, but if let's say you remove your glasses, your vision is 618, you will be able to watch television with comfort. Okay, so the similar thing, if let's say, okay, so watching television, a person has to have a VA of 618. If let's say patient wants to look at bus number, they should have a VA of 69. If let's say patient wants to look at the departure and arrival time, okay, then they have to have at least a vision of 6.9 or 6.12. Okay, so different activities requires different visual acuity. Okay, so based on that, we can get the idea of the distance V acuity, expected VA. Okay, so for magnification calculation, the VA that you should put in is a 6 meters Snellen VA, not logma. So if let's say you measure it using logma, you convert it to 6 meters Snellen and then you insert in. Okay, so this magnification calculation is only done for one eye, better seeing eye only. Okay, even though you are going to prescribe the patient with binocular telescope, but the measurement is only for the better seeing eye. Okay, so for the other eye, when we want to prescribe a biotic telescope or spectacle mounted, right, we give the same magnification. Okay, why do we give the same magnification is because because the poorer eye will have a very high magnification, while the good eye will have a slightly lower magnification. So this imbalance might actually affect the patient while they are viewing something. So usually it is prescribed according to the better seeing eye only. So there is only one calculation for the magnification. And the habitual VA is the better seeing eye VA. Okay, converted to 6 meters Leonard and then insert in, and then you'll get the magnification value. Okay, how do we prescribe this? Okay, binoculars used for static distance viewing, like in the classroom, watching television where you don't move. Okay, you'll be sitting at one place and then that object that you're looking also at one place. Okay, while this monocular is used for viewing stable static objects in the distance for a short period. Okay, they want to, if let's say the patient wants to look at bus number, display number, okay, in the train station, okay, or shop signs. Okay, so all these will be monoculars. Okay, you just need to take this monocular telescope, put it in front of the eye, then you will be able to see the things clearly. Okay, so that is monocularly prescribed. If let's say patient wants to use it in the classroom or watching television, this too will be good. Okay, one thing that you have to remember when it comes to telescope, right? Telescope, you cannot prescribe telescope for a patient who wants to walk with it, patient who wants to run with it, patient who wants to drive in Malaysia. Okay, so this thing you cannot prescribe them with telescope. Why? Is because number one, the image that is seen through the telescope is actually not the real image. It is bigger in size and also the distance is shorter. Okay, so it's not the real distance. So that is the reason why patient cannot walk with that or move around with that, because they won't be able to actually know the distance between the object. So object and themselves. Okay, so this might lead to a tripping and falling. So this telescope is only used when the image or the object that the patient wants to look is not moving around. Okay, so this one you have to remember. Okay, now we move on to the important one, prescribing procedure. How do we prescribe this telescope to patient? Just give me 1 second. So how do we prescribe this telescope? Okay, so prescribing telescope, it is not like spectacles. Patient come in, you do history taking, you check VA, you do refraction, and then you prescribe. No. This one takes time because it's a very new instrument. It is not something that regularly used by, by public. Okay, something is very new and patient has to understand many things about this telescope before we start introducing the device to them or let them try. Okay, a lot of things need to be explained, and it is crucial to explain to the patient. Okay, so that patient understand of what's happening to them. Okay, so number one is review objectives with the aid. Okay, so review the objective with the aids means tell the patient that you came in with this complaint that you cannot look at blackboard in the classroom. Okay, so after do the refraction, we found that the eye power is not sufficient enough for you to do that activity in the school. So we're going to try with a new device known as telescope, to see whether this device can help you to to see better using the blackboard or whiteboard or not in the school. So that's how you review the objectives: complaint, and then assessment, and then what you are planning to do, and also a little bit of explanation on how the vision loss has affected the task to be performed and how the aid will improve this. Okay, if let's say patient have glaucoma. Okay, and the glaucoma is already start affecting the vision of the patient already. So you explain to the patient that you have this pressure in the eye that is actually high for for a normal human being. So that is actually damaging your nerves. Okay, that damage is already start affecting your distance vision already. So that is the reason why with the spectacle correction we are not able to make you to see up to the last line. Okay, so this is the reason why we are trying with the telescope. If let's say the telescope can help you to see things better. Okay, and then discuss the aid and on how it must be handled. Okay, discuss the aid on how it must be handled. Okay, talk to them how it has to be handled, how to hold them. Okay, doesn't matter whether you want to prescribe a binocular telescope or monocular telescope to the patient, but when we attempt in the clinic, right? Okay, we use the a monocular telescope, like as how you do it in the for refraction also. Although you're going to prescribe them with glasses, but when you are trying them in the clinic, okay, or in your refraction room, we use trial frame, right? Similarly, okay, we use a monocular telescope only to measure and see which one that fits the activity that patient wants to perform. Okay, so, so tell them on how to hold it. So which part that should be closer to the eye, which part should be away from the eye, how to twist to change the focus. Okay, so all these need to be explained to the patient. So first you describe the type of the telescope to the patient. Okay, whether you're going to prescribe them monocularly or you're going to prescribe them binocularly. Why you're going to prescribe binocularly, but you're testing it monocularly, explain to the patient. Okay, okay, and then tell the patient that okay, how many what is the magnification that is actually required by them, and explain that if let's say it's a 5 time means you need to have a telescope that actually makes the image 5 times bigger, then only you will be able to see. Okay, so explain to the patient that way, and also show how it is has to be mounted or carried. Okay, and also review its characteristics with the patient. So explain to the patient how this will be actually prescribed at the end. Binocular, monocular, spectacle mounted. Okay, explain to them. Then you review the telescope to the patient. Okay, review the telescope to the patient means first have to let them know which end towards the eye. So as I said, the eyepiece has to be, it stands for the name eyepiece. So the eyepiece has to be closer to the eye or to the spectacles. Okay, closer. So how do you identify which one is the objective lens and which one is the eyepiece? Is the squashy soft part is the um, eyepiece. So it has to be, place it closer to the eye or to the glasses. Okay, and also need to explain to the patient, okay, whether this telescope has to be used with distance spectacles or without. Okay, if let's say there is a lot of improvement in the vision with the spectacles, then yes, definitely they have to use with the glasses so that the clarity of the image is better. Okay, number two is if let's say the the VA improvement is not so much with the distance glasses, then they can use without glasses also. Okay. And also need to explain to patient whether we are going to prescribe them binocularly or monoclarly. Okay. And explain how that is decided based on the task that they want to do. Okay, and also show how the aid should be positioned as close to the eye to increase the field of view. Let them experience it. Okay, so let them experience, first of all, need to, explain to the patient what is field of view. Before, let them try the telescope. Why is it so important is because if, let's say, I introduce a telescope, say that, okay, this telescope will make things, appears bigger and closer to you. You will be able to do, activities that got stranded because of the vision problem. So the imagination of the patient would be very high. They'll be thinking that it will work like a glasses. It's like a special made glasses. No, you have to let them know earlier before they try that this is actually, you cannot use this while walking, while driving, while moving around. Okay, you cannot use this. Okay, and next thing that you have to tell them is the field of view. Okay, just give them example, like if let's say you can see the whole letters, at least know that there are letters in the, the distance we each are. Okay, but with a telescope, maybe you will be able to see only a one or two letters only. Okay, although you can read the better lines, smaller lines, but the number of letters that you will be able to see will be very limited. So explain to the patient and also show patient, okay, if let's say they put the telescope like slightly away, like 10 centimeter away from the lenses, right? That the field of view is limited. And if let's say they bring closer to the spectacles or eyes, the field of view is bigger. So explain to them that this is, the characteristic of a telescope. Okay, once you already show that, then the next thing is demonstrate that the field of view limited. So show them, let them try, and then explain to them that, it is not like a spectacles. And also review the advantages and disadvantages of the aid compared to the glasses. Okay, the field of view, the binocularity, all that will be affected. Okay, once you already done with all the explanation, then you can start with the magnification calculation. Okay, if let's say patient have like a 4 to 5 problems related to distance vision, right? Okay, can we select 4 to 5 telescope for the patient? No. Okay, it is depending on what is the priority. Okay, if let's say they cannot do 4 to 5 activities, right? Which one is the priority? Watching television, like if let's say for a school going kid, right? Is it watching television? Okay, if let's say the patient complain that watching television is difficult and also um, looking at blackboard in the school. So obviously the priority is to the school because they need to learn things rather than watching television. And watching television, we can have alternative like, watching through, iPads, not only focusing on the, blackboard and all that. Watching television directly through TV. Okay. So we choose the priority. Okay. And then calculate the magnification based on the one activity because we cannot, one telescope only has one magnification, which is actually applicable for only one activity. If let's say watching television can, okay, you get it for them, and then with the telescope, they can achieve VA of 618. Yes, they can continue watching television. But if let's say they want to bring to the school to look at, whiteboard, definitely that doesn't work. The magnification is not enough for them to do that activity. That's why I say it is not as comfortable as spectacles. Spectacles, you just turn anywhere, any distance task you can do it, unless if you have some other problems lah, scotoma or anything. But usually you will be able to do everything. But with telescope, it is not like that. Okay, your activities is limited only for the particularly calculated magnification activity. Okay. So once the magnification is already calculated, then we select, telescope for trials. Okay, so how do we select telescope for trial is based on the magnification calculation. Okay, if let's say the calculated magnification is 3 times. Okay, so you have to select 3 telescope with 3 different magnification. Okay, maybe you can get, if let's say the calculated is 3, maybe you can get one telescope wants that lower magnification and wants that higher magnification. For example, if let's say the calculated is 3, then you can get 1 times 1.5, 2 or 2.5 magnification, select 1, and then a higher one, more than 3 diopters, one telescope with that magnification, and also the one similar to the calculated one. So you'll have 3 devices. Every time you calculate the magnification, you have to select 3 devices. Okay, 3 different magnification of telescope. And then what you do is we do assessment with the aid. Okay, so how do we do assessment with the aid? Is very easy. Okay, just ask patient to, okay, and one more thing that you have to remember, when you ask patient to use the telescope, always do the assessment using the better seeing eye. Okay, because the calculation is made from the better seeing eye. Okay, so assessment with the aid is you measure the VA. Okay, so VA measurement, okay, for the 3 different telescope, 3 different magnification telescopes. Okay, you take them. Okay, first give the first one and then measure the VA, the best VA that they could achieve. Okay, using the better seeing eye, and then only one measurement, one IVA, the better seeing IVA. Then the next magnification, give them the next telescope, do that again. The third one, do that again. So once you already get the VA, then you make the decision. Okay, making decision is a bit tricky. Just give me 1 second. How do I say this is tricky? Okay, if let's say, I'll give you a few scenarios, then you'll understand better. Okay, scenario number 1, all the VA that, all the telescope that was tested show that, okay, they have the VA of, if let's say patient wants to watch television. So the best VA that they should, the minimum VA they should have is 618. If let's say telescope 1, patient gets 618. Telescope 2, 612. Telescope 3 is 6.9, for example. This is the VA that is achieved. Which one would you prescribe? Okay, so the answer for this is I'll go for the first one. Okay, the first magnification, which patient can achieve 618. Why? Okay, in low vision clinic, the better VA, the better the performance. That's not the concept of low vision clinic. Our low vision clinic is, okay, once they already achieve the target, then they're considered okay already. Okay, because the lower magnification will have a higher field of view. So patient will be able to watch the television comfortably with that. Okay, so we select that one. Okay, if let's say patient B, scenario B, okay, all achieve target. But when we ask patient which one is more comfortable, patient say all 3 not comfortable. No need to prescribe. Although the VA is achieved or better, but cannot prescribe. Okay, because patient is not comfortable. Patient, if let's say patient is not comfortable, you prescribe them for 1,000, they go back and then they won't use it. Okay, sometimes it looks good. It sounds good while listening to it. But when you want to do it right, it's not good. Okay, it's not comfortable for the patient. They don't like the smaller field of view. So if let's say patient doesn't want, then it's okay. If let's say, okay, that is scenario number 2. Scenario number 3 is if let's say VA, the habitual VA of the patient is 660. Okay, after we give a spectacle correction also still 660. Okay, so we try with this, devices. Okay, and you found that all 3 devices, the VA with all 3 devices is 624. Okay, from 660, it improves to 624. Okay, should you prescribe or not? Okay, clinically, you don't prescribe this. Why? Because if let's say patient wants to watch television, right? Okay, they want to actually watch television. If let's say the VA, although it shows improvement, but if let's say it doesn't achieve the target, then you don't need to prescribe, because even with the telescope, so they will not be able to do the activity that they want. So no point prescribing them with the device. Okay. So first, okay, how do you actually make decision is based on the patient's response and also the VA that is achieved by the patient. They work together. Okay, although the VA achieved but patient is not comfortable, no need to prescribe. Okay, patient is very comfortable but VA is not achieved, no need to prescribe also. Patient is comfortable and the VA is achieved, then can be prescribed. Okay, so that is how we make the decision. Okay, once if let's say the patient is, you're not going to prescribe them with anything. Okay, it doesn't work. Then you straight away can prescribe the next step. Okay, it doesn't work. You just explain to them why it didn't work, why you're not prescribing, and then you end that. Okay, so if let's say patient, you are able to actually, able to prescribe. Okay, patient is happy, VA is also good. Okay, then we practice the individual skills involved in using telescope. So there are 6 techniques that you must teach the low vision patients before they bring back the telescope. One is localization. So how to train them with this localization is just ask them to look at the chart, visual acuity chart, okay, for distance. Ask them, you try to put your fingers to any of the letters within the VA of the patient and ask them to locate your finger. So that is localization. That means if let's say patient able to locate, then that is localization. That means when they use telescope, they can actually locate something, locate the object that they have to use. By training, they will get better. Number 2 is focusing. Adjust the, once, not this adjustment to make it focus, yeah. So the finger is pointing to one of the letter, right? Ask them to turn the, twist the telescope until they make the letter that you're pointing clear and let you know what is the letter that you're pointing. Then what you do is you randomly, point to any letters in any line within the patient's VA. Okay, ask them to let you know what is the letter that you're showing. So that is spotting. Another one is from the top. The next one is tracing. From the top, okay, trace all the letters one by one, okay, for 2 to 3 lines. And then if let's say patient get it correct, then that is spotting. Okay, and then tracking, just bring patient to, to the window or somewhere that patient can see, people moving around. So if let's say, through the window, you can see a car moving, then what you can do is you just sit and then give the telescope to the patient and ask them to track the movement of anything that is moving, like a walking student, walking, you see cat moving around and all that, ask them to track that. Okay, so this is another skill that need to be taught to the patient. And the last one is scanning. Okay, just bring them to one of, the next room or, the room beside. Just ask them to scan things in the room and let you know what are the things inside the room. So this is scanning. So with the telescope, patient able to localize object, focus on it, and then they can spot, okay, to look at the object that they want to see it randomly. They're able to trace things, they're able to track, and also they're able to scan with a telescope. So all these individual skills need to be taught to the patient, train patient with that. Only if you're going to prescribe the telescope to the patient. If let's say you're not prescribing, then no need to do this. And then once you already select the device, then what you do is we don't simply, straight away order the telescope. Okay, the proper way of doing it is you loan your device to the patient, collect the cost price of the device, okay, and then you, ask them to bring back the telescope, okay, and then try to use the telescope for daily activities that they do for distance. Okay, for example, if let's say they requested it for watching television, let them watch television with the telescope. Okay, apply to the everyday task and then come back to us after 1 or 2 weeks time. So when they come back, then we troubleshoot. Okay, so like, assess patients' understanding in the using of it, what's their feeling about the cosmetic appearance. Okay, or if let's say, they say that it was good when I was using it in the clinic, but now not good. Okay, I see blur. Then you ask them to show you how they actually using telescope. Sometimes patient use the
objective lens to view things. So that might not work. So the technique that they use is wrong. So you ask them and then you troubleshoot that. Okay, once patient is happy, if let's say after patient come back 1 week, patient is happy, then you can go to the step number 8. If let's say patient come back and then patient is not happy, then you send them back, okay, by teaching the new technique or modify it, okay, let them get used to it and then come back. Okay, so once decided they're going to prescribe this, then you do the ordering. Okay, so order to the supplier, and then once it's there, then you make appointment for the patient to come and collect the telescope, and then again give a verbal and written instruction to the patient on how to use telescope, what is the activity that is meant to be used for this particular telescope. Okay, once you already explain them, already give the written instruction, you may discharge them with a follow-up, usually 1 to 3 months time, okay, to get their feedback on how this telescope is actually helping them or how is it actually giving them trouble. And then we'll see how we can sort that out. Okay. Okay, I think that's all for distance low vision aids. Okay, so we looked at what is the concept or theory behind it, why we are prescribing it, and also we looked at the types of telescope, what is the advantages and disadvantages. Okay, so we looked at the procedures on how to prescribe this telescope to patients. Okay, so so as an overall, we already covered this telescope lecture. Okay, I think that's all. Thank you so much for your attention.